Okay, so I know I've already done about 25 minutes of the first video, so now I'm gonna try to do this fast because I know you have a lot more students to look over. I know it's pretty long. Okay, so I'm gonna do an abdominal assessment, and I'm gonna, for the abdomen, I'm going to inspect, and then I'm going to auscultate, and then I'm going to palpate percuss, because those last two can alter what I hear when I do auscultate. So I would inspect her stomach for any lesions, all that stuff, right? And I will now auscultate, and I'm going to start from the right lower quadrant upwards to finishing in the last lower quadrant. And bowel sounds usually take about 5 to 30 seconds so I can hear them. So I would start. Okay, I do hear them right away. So they are active. And I would ask the patient, like, when was the last bowel movement, any constipation, anything like that. Okay, so after I auscultate, that's when I would palpate, and I would do this like in a dip, kind of like a pattern. And if the patient were to have pain, I would perform that section last. So, do you have pain? And then, so I'm gonna start where I started when I auscultated, so the right lower quadrant. Let me know if you feel any pain. Okay, and I will do that. And then lastly, her lower extremities. Can you move your legs up? Okay, the other one. Okay, now try it with my resistance. Okay, this one. Okay, good. Can you flex your feet? Okay, and the way I can test her deep tendon reflexes is with like a medical hammer. But I don't have that, but you would do that just to see if they are reactive. And then there's another reflex we check, the Bamsinski, and what you do here, you want to move up, Ali? I don't know if the camera can see. You would put like some kind of like stick right here, and usually when they do that, the feet, they go like inwards, but for the Bamsinski reflex, it's positive if these outer toes go like outwards and then this toe goes up. So that's another thing we would check, but I don't have the instrument for that. And so I would inspect your legs again for any lesions, any kind of abnormalities, and like, especially edema, especially like in heart failure patients, because edema can be present because like the fluid backs up into the peripheral extremities. So I would assess for that. For her, she's healthy, she's fine. So I would assess, especially like in the ankle areas. Which is fine, and I would palpate her popliteal, which is behind here. Her this one is a posterior tibialis. So I would palpate right here. I don't know if you can see. Can you scoot up again, Abby? Which would be right here, over here, and then her dorsalis pedis, which would be over here. I don't know if you can see. And so then you would, while I'm over here, I would check her capillary refill in her toes to make sure they do turn red again after I put pressure. And that's about it. That completes the physical assessment. Hopefully I remembered everything. It's a lot of steps. But yes, thank you so much. Thank you. Oh, and one thing to take note of, I forgot. Before I leave the patient, I would put her like at the lowest position, call bell within sight for her, within reach, bedside table within reach, and just make sure she's comfortable, answer any questions she has, then perform hand hygiene, make sure I put away my equipment. And one thing I forgot to mention in the beginning, and I admit I forgot to mention it, but I will know this, is to perform hand hygiene in the beginning. Yes, and then just verify it's the correct patient you're performing the physical assessment on. So yes, thank you.